Good evening. This is All India Radio, Kohima. I'm Jonas Yantan with Evening News. The headlines. Prime Minister Modi launches customized crash course program for COVID-19 frontline workers. Nagaland's COVID-19 confirmed cases increases to 24,097. Government committed to provide free of cost COVID-19 vaccine to everyone. And Health Minister Vardhan says vision of Tuberculosis-Free India will be achieved by 2025. As many states are relaxing lockdown norms, we advise our listeners not to lower their guard as the COVID-19 pandemic remains a threat to our health. Please stay at home unless it is essential to go out and continue to follow the 4 simple steps. Wear a face mask, maintain 6 feet for social distancing, focus on hand and face hygiene, and get vaccinated. For any COVID-related information and guidance, contact national helpline numbers 011 2397 8046 and 1075 and state helpline numbers 700 55 39653 and 1800 345 0019. And now the news in detail. Prime Minister Narendra Modi today launched a customized crash course program for COVID-19 frontline workers. With the launch program in 111 training centers spread over 26 states has commenced. The program aims to skill and upskill over 1 lakh COVID warriors across the country. The program will create skilled non-medical healthcare workers to fill the present and future needs of manpower in the health sector. Highlighting the importance of this skill development program, Modi has said unprecedented efforts are being made to create a large pool of trained healthcare workers in the country. He said the next phase of an important campaign against coronavirus is starting with this program. He said thousands of professionals were trained in the country during the first wave of coronavirus, which helped in the fight against COVID-19 pandemic. The Prime Minister said customized crash course program for COVID-19 frontline workers will provide skill training to over 1 lakh youths in the country, and the training will open new job opportunities for youths. He said these trained healthcare workers will reduce the burden of the doctors and nurses who are continuously engaged in treatment of COVID patients since the last outbreak of COVID-19 pandemic. Customized crash course program for COVID-19 frontline workers has been designed as a special program under the central component of Pradhan Mantri Kaushal Vikas Yojana 3.0. The training will be imparted to COVID warriors in 6 customized job roles, namely home care support, basic care support, advanced care support, emergency care support, sample collection support, and medical equipment support. Nagaland's confirmed COVID-19 cases increased to 24,097 as 56 new infections were detected today. State Health Department said 14 new cases were detected from Mogokchung, 12 in Kohima, 10 Dimapur, 8 Beren, 4 Mon, 3 each in Pek and Twensang, and 1 each in Wokha and Zonuputo. A total of 362 positive patients recovered, which include Dimapur with 234, Kohima 45, Wokha 29, Mon 19, Mogokchung 17, Kifure, Longling and Pek 5 each, and Beren, Twensang and Zonuputo 1 each. With this, the total number of recovered cases has mounted to 20,887, improving the recovery rate to 86.67%. A positive patient's demise has increased the casualties to 453. Union Health Ministry said a total of 88,977 patients recovered during the last 24 hours. This has taken the total recoveries across the country so far to over 2,85,80,000. Recovery rate has increased to 96.03%, and daily recoveries continue to outnumber the daily new cases for the 36th consecutive day. Prime Minister Narendra Modi has said that the government is committed to provide free COVID-19 vaccines to all. He said vaccination coverage will be expanded from 21st June, and the same facility will be provided to the people aged above 18 years, which have been provided to people aged above 45 years so far. Talking about the changing nature of the coronavirus and the country's resilience to deal with this infectious disease, Modi said COVID-19 pandemic has helped in developing a robust medical infrastructure in the country. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on a YouTube channel, AIR News Kohima. Union Health Minister Dr. Vardhan said Prime Minister Narendra Modi's vision of tuberculosis-free India will be achieved by 2025. Chairing a high-level meet yesterday with corporates to discuss voluntary crowdfunding for treatment of patients suffering from rare diseases, Dr. Vardhan said DB will be eliminated in the same expeditious manner as polio. He also enumerated the different steps taken by the government in facilitating creation of an environment which promotes research and development of diagnostic and therapeutic interventions for rare diseases within the country. He also mentioned about a national digital portal for crowdfunding created by Health Ministry that will enable donors from various sections of the society to take care of patients suffering from rare diseases. The minister said this is a unique initiative by the ministry, and for the first time, such a government portal for crowdfunding has been created. Union Minister of State for Chemicals and Fertilizers, Mansukh Mandaviya, said that the government is continuously engaged in boosting the production of liposomal amphotericin B injections. He said the domestic production of liposomal amphotericin B used in the treatment of black fungus increased by more than 5 times in just 3 months. He said domestic production is expected to cross 3.75 lakh vials in this month from the domestic production capacity of 62,000 vials in April this year. The Election Commission of India has released an atlas on general elections 2019. Chief Election Commissioner Sushil Chandra, along with Election Commissioners Rajiv Kumar and Anup Chandra Bande, released the atlas. It consists of all the data and statistical figures about the 2019 general election. It has 42 thematic maps and 90 tables depicting various facets of the elections. The atlas provides interesting facts, anecdotes, and legal provisions related to elections. It serves as an informative and illustrative document that brings to light the nuances of the Indian electoral process and empowers readers to analyze trends and changes. Nagaland Advisor for Youth Resources and Sports, Zalin Nikha, today released the first extended play EP created and titled 18 by Desert Sotu. Speaking during the formal function, Nikha, while maintaining that not everybody can become an IAS officer, doctor or engineer, said the youngsters should focus on their gifted talents with consistency to be successful. Appreciating Sotu and other young local talents in the field of music, Nikha said the government through the task force on music and arts will make efforts towards promoting them locally and beyond the state. In the introductory note, Sotu said EP 18 has a total of 5 tracks and is made available to stream on all major streaming platforms. The Army has invited applications from candidates to apply for the NCC Special Entry Scheme. Male and female candidates who are eligible to apply for the post can apply online through the official site of Indian Army on joinindianarmy.nic.in. The registration process started on June 16th and will end on July 15th. Candidates must note that they can appear for only one of the service's selection board interviews. Candidates should have a degree of a recognized university or equivalent with an aggregate of minimum of 50% marks, taking into account marks of all the years. They should have served for a minimum of 2 to 3 years as applicable in the senior division of NCC. And now to the news, here are the main points again. Prime Minister Narendra Modi launches customized crash course program for COVID-19 frontline workers. Nagaland's COVID-19 confirmed cases increases to 24,097. Government committed to provide free COVID-19 vaccines to everyone. And Health Minister Vardhan says vision of tuberculosis-free India will be achieved by 2025. That is all we have in this evening news bulletin. Good night.